Let me go ahead and get started. Thank you, everybody, for joining us. And Dr. Motwani, thank you very, very much for your time. I want to introduce to everybody Dr. Bharat Motwani. He's the head of the infectious disease for Genesis here in Davenport. And but more importantly, he is my next door neighbor, along with his wife Preeti and his two lovely daughters. So with that, Doctor, I thought maybe you could just give us a little, background of what you do and what you're doing at Genesis and sort of the state of COVID in the Quad Cities and Illinois and where we're headed and more importantly, your thoughts on the various vaccines and why you think we should or should not be vaccinated. So with that, I'll turn it over to you, Doctor. So
Sure,
thank
sure,
you.
sure, sure. Hello, everyone. Thanks for having me today, giving me opportunity to talk about COVID and COVID-19 vaccine. As you all know, this pandemic started almost a year. Hopefully, what I'm hoping is that things are definitely better than last year when this all started. And I'm hoping the COVID-19 vaccine will pull us through this pandemic and we'll be hoping to get back to normal as soon as we can. I've seen a lot of patients with COVID-19 here. At one point, we have 150 to 200 patients at Genesis, all COVID patients. Seen a lot of patients dying from it. So I'm very passionate about COVID-19 treatment prevention. So to me, any one patient you can prevent from getting COVID-19 is worth it. So, and that's why I'm very passionate about COVID-19 vaccine. When the vaccine came out, the data, if you look at the COVID-19 vaccine data, it was supposed, there are three fearful outcomes of COVID-19. One is the patient getting sick, very sick, getting hospitalized, and dying from it. So when the data came out about the vaccine, data showed that vaccine is very effective in preventing all of those three outcomes. And I was very excited. We didn't know whether the vaccine will prevent somebody from getting the infection. We did not know whether the vaccine will prevent transmission or not. But just the fact that vaccine will prevent someone to get hospitalized will to help me to save them and they will not die from it. That was worth it. Now, there's a lot of data coming out from other countries. There's also data we are looking at in the US that now shows that, especially from Israel, if you look at it, vaccine is not only effective in preventing all those three outcomes I said, but it's also very effective in preventing transmission. It's also very effective in somebody getting sick. So that's a cream on the top of what I already knew about the vaccine. So I'm more excited about the vaccine now as compared to even like 2 months ago. So if you look at the Israel, which I mentioned, they vaccinated the 57% of the population, and their rates had gone down significantly. And that's what I'm hoping that if we get the vaccine in our community, hopefully our rates will go down too. I never want to see the rates again, like 150, 200 patients again in the hospital. For last 10 days, 2 weeks, we have started our number going up again. I still hope that it will not get up to that point, but I'm hoping as we roll out the vaccine, we'll see less and less number of COVID-19 patients. Even if I have to see any COVID-19 patient, I will not be complaining. I have a lot of other things that I can deal with. I will be very happy the day when there will be no COVID-19 patient. So that's what I'm here for. So what I've done in last month, 2 months is just go out and ask people, what do you think about vaccine? Are you going to take it? If you're not going to take it, is there anything I can do to convince you that vaccine is safe, that vaccine is effective, it's working? As Jeff said, I had two daughters. So before I took the vaccine. So before I took the vaccine, I really looked at the data very carefully because I wanted to be there when they grow up. So once I was convinced myself that this is very safe and effective vaccine, I took it myself. And that's the message I'm trying to give to everyone, that I'm not here just to say that take the vaccine. I'm here to answer your questions. I'm here to answer. If you have some fears, maybe I can talk to you about it, and we can discuss this together. Taking a COVID-19 vaccine is a personal decision, and I'm hoping that I can help you making that decision. So Jeff sent me a few questions here, about 7 of them. So I will go over the questions one by one. So the first question is it safe for someone with pre-existing blood clotting issues to get vaccinated? My short answer is yes. And if you look at the coronavirus, the COVID-19 virus, it amazes me. This virus is very different from the viruses that we've seen. This virus itself can cause blood clots. It causes blood clots in the lung, it causes blood clots in the brain, it causes blood clots in the heart, gut, eyes, everywhere. So, to me, if somebody has a pre existing condition that can predispose them to blood clot, getting a COVID-19 disease will make them very high risk for getting the blood clot. So, if you can prevent yourself by getting COVID-19 by getting a COVID-19 vaccine, that's the best way to prevent it. So I will strongly encourage if somebody has a pre-existing condition like this to take the COVID-19 vaccine to prevent getting the COVID-19 disease. The second question is how long after the vaccines are administered they are effective. So this is true for every vaccine. It takes about 2 to 3 weeks for the body to develop antibodies and to be fully immunized against that particular disease. And same thing is for COVID-19. So after you receive 2 weeks after the second dose of COVID-19 vaccine, you're fully immunized. Now, one of the vaccine made by one of the company Johnson and Johnson is just one dose. So again, 2 to 3 weeks after that dose, yeah, you are fully immunized and protected against COVID-19. Having said that, I just want to say it: no vaccine is 100% effective. So I'm sure you heard in the news that vaccines are very good. They're effective 90-95%, but they're not 100%. So yes, you will develop antibodies, but again, that's not a guarantee that you're 100% protected yet. So if we vaccinate everybody, then yes, then the virus don't have anybody to infect. Then it will be almost 100% protection. But until that happens, we are still at risk for getting the COVID-19. And that's why the CDC comes out and says, still follow all the public litigation measures like masking and distancing and things like that. But as I said, that once everybody gets vaccinated, we get the herd immunity. I think we'll start seeing the relaxations of all those guidelines. So other question is, will somebody require a booster dose? We don't know the question to that yet. We are seeing more and more variants. So it's possible that as more variants spread, we might require tweaking of the vaccine and we will require the booster dose. It's also possible. There's good data coming out that vaccine protect you at least for 6 months for sure. So if it's like a flu vaccine that you get a shot and you have antibody for 1 year, but then it goes away, then yes, we'll need the vaccine every year, just like a flu shot. The variants, I want to just take a moment and talk about the variants. We are seeing more and more variants. So what are the variants? They're the mutations in the virus. They're mutations in the COVID-19 virus. And we knew that it's going to happen. Even before it was widespread, COVID-19 has very good capability to mutate. So we just knew the mutations are going to happen. Most of the time, mutations make the virus weaker, but sometimes there are mutations that make the virus stronger. So if you look at the variant, the UK variant that everybody talks about that's spreading in our country, that can make this virus a little bit stronger, so it can be more deadly and it's very efficient in transmission. And the vaccines still work against that variant, but it's not 90-95% effective, which was there in last year as the vaccine data report come out. It's less than that. So that's why I said the more vaccine we give, the more people we protect from giving vaccine, there will be less chance for the variants to emerge and will be in better shape. If so, this is a race between vaccine and the COVID-19 virus. So if we win the race, then I think it will be more effective. Right now, we say we need 70% immunity, but if the variant spread, then it will be now 70% herd immunity. It will be 90% herd immunity. It will be more than 90% like that. So that's why I hope that we will win the race between the virus and the vaccine. The next question is, do you have to wait to resume allergy shots? No, you don't have to. One of our neighbor is allergist, I had discussion with him regarding this. We do not want to give allergy shot on the same day. Actually, there's no medical contraindication to get allergy shot at all. But we don't want to give the allergy shot on the same day, just in case there's an injection reaction. So we want to wait for a day or two after you have the COVID-19 vaccine. But medically, there's no indication that you have to wait to get allergy shots. Sure, sure. So other question is the restriction from traveling or going to other countries. I don't know that. I think that's the question to answer is our political leaders. So I think they can answer that better than me. As a doctor, I don't want to restrict anybody from going anywhere. Whether you have vaccine or whether you don't have vaccine, as I said, it's your personal decision. So I don't know what will happen, whether we'll be allowed to travel or whether we'll be restricted. So I don't know the answer to those questions. The next question is about the children. So right now, vaccines are not approved for children below 16, but they will. So there's a very good data coming out that says the Pfizer vaccine, and the data from the Pfizer that says vaccine is very effective for the children between 12 to 15 years old. So that the recommendations will come out from FDA soon that yes, children can be vaccinated. I'm hoping by the time school start, that vaccine will be available for the middle school and for the high school children. Um, the data for the elementary school children may not be available until the end of the year or by early next year. So I don't think FDA will approve the vaccine for elementary school children yet. That means one of my kids will not get the vaccine. Only one of them will be eligible for it by the fall. But right now, not have data for the kids below 12, and we're still looking at the data between 12 to 15-year-old. One of the questions that I always get is, well, why did FDA approve under emergency use? They didn't approve it completely yet. What does that mean? Does that mean the vaccine is not safe? Well, we're in the middle of pandemic, so we needed to work faster to make sure that we are getting effective medicine, effective vaccine for the patients so that we can save patients. And actually, emergency use authorization started after 9/11, that if there's emergency situation and we need to do something that's a life-saving measure, then we can bypass some of the bureaucratic stuff and get stuff approved faster. That doesn't mean the corners were cut. If you look at the trial, traditionally what happens that is phase one trial, then there's a phase two trial, then there's a phase three trial. So that's why it takes years and years for the medicines or vaccines to develop. But all those trials happen at the same time. Phase one, phase two, phase three, all happen sequentially rather than followed by each other. Other thing I've heard is that this is a new technology. Well, I worked at the Rockefeller Center before I started my residency training. So I'm talking about 1999, 2000. I was very excited about this mRNA technology at that time. But the problem at that time was, as soon as we give mRNA, body will destroy it. We will never be able to do what we wanted this mRNA to do. What does mRNA does? It goes inside the cytoplasm of the cell. It's like an instruction sheet. And then it tells the ribosome that these are the instructions to follow. And if you follow this is what you're going to get. And that's it. So ribosome of the body makes the antibody against this particular protein. And that's what all in the vaccine. If you look at the Pfizer and Moderna vaccine, that's all they have. So what happened between 1999 2000 until now is they were able to figure it out how to stabilize this mRNA. So what they did, they took the mRNA, put it inside the envelope, which is made up of lipid, and they put that lipid envelope inside the muscle that's taken up by the body cell. Once the lipid envelope dissolves in the cytoplasm, mRNA is in the cytoplasm. It never enters the nucleus. Even a medical student will tell you that mRNA cannot go inside the nucleus of the cell where our DNA is. So it has no effect on the DNA. It stays in the cytoplasm. It's just one-way street. mRNA cannot get inside the nucleus. So it goes to cytoplasm, give instructions to the body, and that's how the body makes the antibody against this particular protein. So if you look at the vaccine has this lipid envelope that has mRNA in it. It has a sugar. One of the Moderna vaccine, I think, has a salt in it, and that's it. There's no egg. There's no animal protein. There's no fetal tissue. There's nothing else in that vaccine. Just mRNA with envelope, sugar, and salt, and that's it. Nothing else there. So is it a new technology? No. I mean, I worked on this technology in 1999, 2000. People before me have worked on this technology. At that time, which was just not advanced. Other thing I want to remind people that there were two outbreaks of similar kind of virus. One was in 2003, we call it SARS virus, SARS. In 2012, MERS. The animal studies on that SARS virus were done in 2003. So people say, well, no animal studies were done. They were done in 2003. So it's not like we made a shortcut last year. So animal studies were done. In 2012, this technology was introduced to make the vaccine against the MERS. We never had to use it because it never became a pandemic. And the outbreak went away. But when the pandemic started last year, we had the lessons from 2003 and 2012 that helped us in making the vaccine faster. So we have a very effective vaccine, and I think we responded very well. Kudos to us that we were able to respond in such a better and faster way to stop this pandemic. I see as a plus point rather than a negative point that these vaccines were developed very fast. So I think that's the marvel of technology. If we didn't have the technology, we would now been able to do this. And I think the mRNA vaccines here are going. We developed mRNA vaccines against Ebola. There are more and more mRNA vaccines you will see in the future. This mRNA technology is used in the cancer a lot. So this mRNA technology is here to stay, and you will hear more about it. So it's not a new technology. I will stop there and get the questions from Kelly. Any Kelly questions?
I got one question from an employee. They said, I give blood. My next donation is Tuesday, and my COVID shot is this Saturday. Should I postpone giving blood?
I got the vaccine and I donated blood. So yes, you can still donate blood while getting vaccines.
Okay.
Doctor, is there a preference of one vaccine over the other, or just get one as quickly as you can?
Also get one quickly as you can. Even though if you look at the numbers, some numbers says Johnson & Johnson is only 80% effective as compared to, say, Moderna or Pfizer, which is close to 94%. But honestly, the efficacy numbers that they put out in the trial are very different from the effectiveness. It's like a car. I always say, like, if you're buying a vehicle, it says it gives you 30 miles inside the city. Well, you never get 30 miles per hour inside the city. It will always be like 25, 24, something like that. So when I look at the efficacy trial, yes, the numbers are out there. The question is how effective the vaccine is in the community when they're giving it to people. And based on that, I think all the vaccines are very effective in preventing all of those outcomes that I talked about before. So I will take any vaccine that you have available. Johnson a lot is one shot and get it done. But any vaccine is, all the vaccines are equally effective, and I cannot recommend one versus another.
How long, if someone's diagnosed positive with COVID-19, how long after that diagnosis should they wait?
Sure. So there are lots of ifs and buts to that question, but I will try to make it very simple. Once the person outside the infectious period, outside the quarantine, they can go and get the vaccine. So after 10 days, they can go and get the vaccine.
Okay.
Now, people with COVID-19 disease develop antibody. Again, when you give COVID-19 vaccine, you're developing antibody. So people always ask me, well, why do I need the vaccine if I already have the disease? So if you look at the amount of antibody from the disease and amount of antibody from the vaccine, amount of antibody from vaccine are much higher. That's why even though somebody has a disease, we say get the vaccine so they are better protected.
Okay. Kelly, there was one. We had another one. Did you get it?
Yep. For the 2-dose vaccine, does the first shot have any positive effect, or is it only after the second?
I'm the follower of the rule. So if you look at the trial, we do know that once you get 2 doses of vaccine, then you get a better protection. So I always suggest, yes, definitely get the 2 doses. In Johnson & Johnson case, it's only 1 dose.
Doctor, so until we have herd immunity, we need to continue wearing masks and social distancing and all that, correct? Is that what you're saying?
Sure.
Okay.
So we still have to follow those measures.
Yeah.
The reason is that vaccine is not 100% effective and we do not have herd immunity. So once we get herd immunity, as I said, I'm sure the CDC will relax those guidelines and we will be hopefully end the pandemic and go back to normal. But as I said, it's a race between variants and us. So I'm optimistic that we'll win this race. But I need all of you in this together. So I see the Jeffrey says "Together we can." It's in the back. There's a logo. So yes, together we can do this. So
there you go. Okay, doctor. Any last words of advice?
As I said, COVID taking a vaccine is your personal decision. I hope I have convinced you. I've helped you in making that decision. But as I said, I think we can do this together. We can end this pandemic.